This is Mike Natalizio, President and CEO of HNI Risk Services. I'm with Jon Gabel. We just completed our workshop, HNI University workshop, entitled Act or React. And during this session, we informed some of our customers and friends on the upcoming, or not the upcoming, but the recently passed legislation, the new law on healthcare reform. And Jon gave us a great overview of what was going on and what's going on from his perspective. And I thought we'd just ask you a few questions, Jon, if we could, after going through this experience. We thank you for that. You had a chance to really talk to some of the people. You heard some of the questions. You saw the eyes roll back in their head a few times, and as they were trying to absorb all the different nuances of healthcare reform. But maybe you could share with us, the response that you heard, some of the questions, and maybe the pulse of the people that attended that workshop.
Well, let me just start off with my response. My response is I am flying at 50,000 feet, and I'm thinking, how do we change this healthcare system in this country, which I see as being so inefficient, so costing so much, and not providing better quality of care than what the other nations of the world say. But then as I talk to actual employers, and knowing that this reform system is supposed to enhance the existing employer-based system, what I see is how these changes at 50,000 feet lead to very specific and detailed changes that every small and large employer in the United States will have to be aware of. So that's the first impression I came away with. Second impression was, based on some of the questions, is that I'm afraid too many people are getting news at the wrong places. They're listening to cable. Cable's trying to be provocative. Cable's thinking about ratings. Unfortunately, what do they say about war? If we think of ratings war, the first casualty of war is often the truth. Mm-hmm. So my second thought was, people are trying to follow this, but if you're getting your information from cable news, unfortunately, many times you're getting the wrong information. So there's a need to look at more reliable sources than that. I thought many of the questions were very detailed questions, which showed that some employers have done a great deal of work trying to examine the consequences. I also thought, based on some very thoughtful questions, that we know many provisions of this reform are actually ambiguous at this point. Nobody, I think, really knows how the 3,000 pages of reform, how it's really going to, in the end, come out. Because the 3,000 probably needs 6,000 or 9,000 pages.
Well, when you mentioned the credibility of the information and the news sources, what would you point to as maybe some of the biggest misconceptions about healthcare reform that's kind of circulating out there in the world?
Well, I can just, one of the questions was everybody thinks their plan's going to be taxed. Not true. Small employers, we heard questions, they seem to think that they're going to have a special tax. One person had a very difficult time realizing rather than being taxed, he was actually getting his price was being lowered, that if he was cognizant, he took advantage of the law, he could get a credit instead. I didn't hear at this time, but I have heard at other times, people believing, well, I won't be allowed to choose my plan anymore. And that's not true. I saw from some of my conversations, a lot of small employers think that have really come to the recognition that having the advantage of the so-called exchange will probably give them better choices. I think maybe a lot of the discussion, what brought out for employers, is that this bill will strengthen the financial incentives you can use to get your employees to promote their health. There are stronger financial incentives to stop smoking, and there's stronger financial incentives to lead a healthy life. So I don't think many people perceived that before they heard the presentation this morning.
Right. As far as some of the other misconceptions that owner, I mean, I hear a lot of when we say small employers, under 100.
Under 100, yes.
It's probably a definition to use, but where they say, well, I'll just pay the tax and bail out of this, and I'd rather just pay the tax and I'm out of the healthcare business. How would you respond to that kind of a position from an employer?
Well, I guess it depends on what kind of employees you want to attract. I think the same reason you have for providing health insurance now will continue in the future, because without health care, I would presume that our health declines, and unhealthy employees are less productive, will most likely to be absent, or more likely not to be productive. Their dependents are more likely to be sick. This is going to take their toll. So whatever reasons you had for offering health insurance before, you still have those reasons. On the other hand, if you don't offer health insurance and you're not offering it now, there are financial penalties if you have more than 50 employees. So it will depend greatly on your workforce, but there are most definitely for firms with more than 50 employees strong incentives to offer coverage and to continue to offer coverage.
Mm-hmm. In your presentation, you talked about how the United States compared to other countries,
yes,
and our cost of health care.
Yes.
And I think you said we were
twice as expensive as Switzerland is the second most expensive system in the world, and our per capita costs are twice as high. And we're twice as high not because we go to the doctor more, not because we go to the hospital more, in fact we go to the hospital less, not because we use more drugs, but basically because we pay our providers more and we have higher administrative expenses. And the cost of a hospital day or the cost of a hospital visit is much greater than it is in other countries. So, I come away when I look at the aggregate statistics with the belief that we can do better. We should be able to do better. We don't do better on quality of care. We pay twice as much, we should do better. In fact, we're right in the middle of the pack. We do some things very well and we don't do some things well. And many of the things that we don't do well, there's really no excuse for.
John, you're not from the insurance side of the equation here.
Right.
And as we look at healthcare reform, it appears that the insurance industry is reforming directly. What about that side of the equation, the healthcare costs? Do you see reform coming down the road on that side of the equation as well?
Well, it certainly has. It's certainly a lot of the reform was targeted at insurance companies. The general intent was to change our healthcare system of one where insurers could compete by keeping sick people out of their plan and attracting health people and pricing accordingly, to one where they could no longer do this, so banning pre-existing conditions, trying to provide better information to purchasers of health care, so they better know the price, they know how much of the premium is going to be going to medical expenses and how much is going to be going to the insurer's administrative expenses. All this will greatly change the role of the insurer from what they were before. We have more standardized policies. And I guess there's good news and bad news. The bad news would be there can't be as much flexibility in designing policies. The good news would be for shoppers, it's much easier to compare apples to apples, and this would bring about a more price competitive market.
You touched on it a little bit earlier about what employers should be doing, but as a large or small employer, what advice do you have for the next 3 to 6 months? Should we sit back and let things kind of settle down, or do you have some words of wisdom in that regard?
Well, first of all, I'm going to quote Shakespeare. Shakespeare said, "Writers are not good doers." So I'm not very good at doing pragmatic things. So I guess I'd say you should talk to who are pragmatic people. I think all employers should be trying to read objective websites. I recommend Health Affairs, the Bible of health policy. I would say also you should be keeping in touch with people whose business is to advise you. So that means consultants and brokers and agents.
Great.
Let me throw one other thing, and I really believe that in the bottom line, all this is not just cost; it's improving the health of employees. And if you have programs that are successful in improving the health of employees, I would say continue them. Don't wait for reform. Just continue doing them.
Great. Well, John, thank you again for a great presentation today and taking the time to sit with me in this post-workshop interview. And we hope to have you back again. We've had you here before, and we hope to continue that at another HNI University event. And that's it. Thank you.
Great. Please invite me again.
Will do.